We'll get started. I just want to make sure. Hold on one second. I'm so sorry.
It's okay.
Okay, so we'll just get started. So I want to thank everybody for coming tonight. So we will be recording this talk, and it'll be available on the library's YouTube channel. We do ask that everyone remain muted. If you have any questions, you can either type it in the chat box, or at the end there should be time for questions. I want to welcome also Dr. Kathleen Cannon, who is a naturopathic physician, and thank her for taking the time to give tonight's talk, Gut Microbiome. So I will turn it over to Dr. Cannon.
Thank you, Caroline. Hi, everyone. I'm Dr. Kathleen Cannon, and I'm looking forward to sharing about the gut microbiome with you. So let's get started here from this beautiful picture. Oop. Okay, so we're going to go through some different aspects of your gut microbiome. So we'll start talking about what exactly is your gut microbiome, and then we'll go into why it's important. And then we'll talk about imbalances that can happen, issues that can come up with your microbiome. And we'll also talk about probiotics and prebiotics. I get asked about those a lot. And then we'll talk about research, some examples for specific conditions, and then some additional information, and then we'll have time for any questions. And like Caroline mentioned, if you have a question as I'm talking, or if you need a clarification of something, just type it in the chat, and Caroline can let me know, because there are some terms that could potentially be confusing. So feel free to ask. Okay, so just as a reminder, always check with your own healthcare provider because you're an individual. And all right, let's get started on the microbiome. So with your gut microbiome, what is it really? It's made up of all of these teeny tiny little organisms that live inside of your digestive tract. When we're talking about your gut microbiome, it's inside of your digestive tract. And these tiny little organisms, they're bacteria, and also fungus and viruses, and even protozoa. Bacteria is what we're usually thinking of when we're talking about the microbiome, but I just want to point out that there are some other bugs that live in your microbiome as well. And this picture here is kind of a nice, simple visual because you can see your whole intestine in a sense. So you have both a small and a large intestine. And the large intestine is the darker pink tube on the picture. And that's actually where most of your microbiome is in your gut. The small intestine is much narrower and it's very, very long. It's all kind of squiggled up inside there. So that's like the light pink inside. And there are bacteria that live there. But when we're talking about your gut microbiome, we're really talking about what's in your large intestine, which is also known as your colon. Okay, so if you didn't know, you also have a microbiome in other parts of your body, including your skin. You have a skin microbiome, so bacteria that live on your skin, and they're supposed to be there. It's healthy. And then also in different parts of the reproductive system. So for females, the vaginal canal, and for males, parts of their reproductive system as well. And then we also have microbiomes in other places in the body. The general term microbiome, most people think of the gut. That's usually what we're talking about. So with your gut microbiome, again, it's these tiny little organisms, and you actually have more of these organisms in your body than you have cells in your body. And it's estimated somewhere around 100 trillion microbes living in you. And so that's a huge number. And of course, the scientists, researchers, they don't count all of these tiny little microbes they're estimating. So estimates can vary, but somewhere in this range is kind of the current consensus. So your gut microbiome itself, all these bacteria, there's a huge variety of them. There's lots and lots of different strains of bacteria, and everyone has a different microbiome. So there's no like one recipe for the best microbiome. That's not a thing. Everybody's is different depending on their own health and how their body has developed and evolved. So I like to really think of the gut microbiome as an ecosystem. kind of like a rainforest. And so I put this picture here just as a nice little visual. In a rainforest, you have all of these different animal species, plant species, you've got flowers, you've got really tall trees, you've got like ground shrubs, and then there's weather that comes in, there's rain, there's also pollution, all these different things happen and everything kind of survives. And that's kind of what happens in your gut microbiome. It's impacted by a lot of different things, and there are a lot of different things living there, but everything survives and it functions to help you, really, to help your health. And ideally, just like with a rainforest, ideally your gut microbiome can sustain itself, and ideally you don't need external support. That's kind of the goal. And I just thought this was kind of a cool picture. So this is actually in the small intestine, not the large intestine, but just a visual of the tube and then kind of bacteria floating through the tube that is your small intestine. And all of these little pink projections, those are parts of your small intestine. They increase the surface area of it. So yeah, just a cool picture. All right, so your microbiome, your gut microbiome, it's involved in a lot of different processes in your body, a lot of different functions, including how you digest your food, the production of different metabolites and other substances, including some enzymes, and also even vitamins. Your microbiome supports healthy bowel movements. It also helps the integrity of your gut lining, so the actual cells in your colon that keep your colon really healthy. It supports those. It also modulates immune function, and it can prevent the overgrowth of pathogenic bacteria, and it can also help your body to deal with toxins and with other things that come into your gut. So imbalances in the microbiome are really, really common, especially because we're living in, the modern world. So really common to see these imbalances in the microbiome. And an imbalance basically means that your microbiome is out of balance, that ecosystem, it's not able to sustain itself like we want it to. It needs a little bit of support. Now, sometimes with imbalance, your gut microbiome can correct itself. It can and ideally, that's what we want. We want it to be able to correct itself and come back into balance. But often it can use a little bit of support. So pathogenic bacteria or bad bacteria kind of in general, they can overgrow when imbalance happens. And if they overgrow, other things can happen that we don't want. And then beneficial bacteria can also be kind of destroyed if other things are overgrowing. So imbalance is kind of like too much bad stuff and too little good stuff. And also just kind of the weight of different species can change, and that can affect your health. So when this imbalance goes unchecked, it can continue to get worse and worse, and it can impact your health in different ways. Kind of like if there's a fire that starts and it goes unchecked, it's going to just kind of keep getting worse. You need to deal with the fire and then allow things to kind of rebuild. And I just want to point out one thing here. I'm kind of simplifying when I say pathogenic bacteria, because pathogenic bacteria, we all have them in our gut, and it's good that they're there, and they just are kept at a very, very low level, essentially. It's when they overgrow that they become a problem. So they are part of a healthy, normal gut flora or gut microbiome. They're part of that, but when they overgrow, they become bad. So I just want to point that out, because they're not all bad. They're going to be there, but they become bad when they overgrow. Okay, so what can cause imbalances in your microbiome? Well, all sorts of stuff. So especially things that you're putting into your body, right? Anything that you're consuming. So that includes foods that may not be great for you, drinks that may not be great for you, including like alcohol, especially excessively, pharmaceutical drugs, and also some supplements, environmental exposures like chemicals, toxins, that sort of thing, illnesses, disease states, compromised health, trauma, injuries, and stress. Definitely stress can have an impact here. So all sorts of different things can really impact your microbiome. It's not a super simple thing to really evaluate. There's a lot of factors. When you do have imbalance in your microbiome, some of the more common symptoms can include things like bloating, passing a lot of gas. So some gas is normal, but if you have a lot of it, that's not your normal. Burping, Sensations like gas bubbling, or some people will describe like a gas pain or a funny feeling. All of those kinds of sensations can indicate an imbalance. Also changes in bowel movements, especially diarrhea and constipation, and there's lots and lots of different variations there, but changes in your bowel movements can indicate imbalance as well. And these symptoms are not only symptoms of imbalance in the microbiome, they can also be symptoms of other conditions and other potential illnesses. So they're not exclusive to the microbiome. And then you can also have symptoms of imbalance that involve non-digestive systems, because your microbiome, again, it impacts a lot of your body's functions. So insomnia, that could be related to an imbalanced gut microbiome. Anxiety also could be related. Mood changes, mood swings, irritability, depression, different things kind of in the psycho-emotional mental state could be related. And then weight gain, metabolism changes, memory issues, focus and concentration difficulties, and the list could go on. There's a lot of things that could be reflecting an imbalanced gut microbiome. But again, these things are not exclusive to the microbiome. They could be due to other factors. And often, with the body, often there's multiple factors in what we're experiencing. And then lastly, but not least, most of your immune system is located around your gut, in your belly, around your gut. That's where most of your immune system is. So having a healthy gut microbiome is also important for healthy immune function. So how do we deal with imbalance? When we figure out that there is imbalance, how do we deal with it? Well, the sooner we address it, the better. And then we can also work to prevent imbalance by really trying to keep our microbiome healthy. And just for example, if we know that we're going to be exposed to something, or if we know that we're going to, go to a big party and eat something, not that we're really doing that during the pandemic right now, but if we know that we're going to have an exposure that could upset the microbiome, we could work to kind of prevent the imbalance from happening. So keeping your microbiome healthy means being aware of what really could impact it. And so think about, for you, what could be throwing your gut microbiome off balance potentially? Does anything really stand out? Or maybe you know that there are things in your past that could have impacted your gut function and potentially your microbiome. So what are those things for you potentially to think about? So all of those factors that we mentioned before, essentially, a lot of them are what's going into your body: food, drink, medications, even some supplements, and then exposures, and then again, the stress and your other health conditions. An example here that's a really common example is antibiotics and their effect on the gut microbiome. So antibiotics, we know they're meant to kill the bacteria that cause an infection. But because they're killing that bacteria, they're also going to affect other bacteria in the body. They're not just affecting that one and only bacteria. They're affecting other bacteria in the body, including your microbiome. So a systematic review and meta-analysis that was published in the Journal of the American Medical Association stated the pooled evidence suggests that probiotics are associated with a reduction in antibiotic-associated diarrhea. So diarrhea that comes as a product of taking these antibiotics. And then they say more research is needed to determine which probiotics are associated with the greatest efficacy and for which patients receiving which specific probiotics. So they need kind of more detail. And this speaks to something we'll talk about in a moment, but there's a big variety of different probiotics. So to understand really what's going to be the best, they need more research, but they do see that probiotics reduce this antibiotic-associated diarrhea, which can reflect that impact on the microbiome. So we know that antibiotics affect the microbiome, which destroys some of that healthy bacteria. So something you could consider is that if you are prescribed antibiotics, you could take a probiotic to replenish what's destroyed. Now you'd want to discuss that with your doctor to make sure that it's appropriate for you, but you could take the antibiotics during the probiotics. You could take the probiotics during the antibiotics course, all of these biotics. So you could take the probiotics during the antibiotics course. They're not going to affect the efficacy of the antibiotics at all. And then you could also continue the probiotics for several weeks after the antibiotics to really replenish what's been destroyed. And if you know you're going to be taking antibiotics, which isn't often the case, but it can be, you could actually take a little bit more probiotic ahead of time even. If you do take a probiotic along with an antibiotic, because this is a common question also, if you do that, you definitely want to take them at separate times of the day, because the antibiotic is still going to destroy some of that good probiotic stuff. But if you take them together, it's going to wipe out a whole lot more than if you take them at separate times. So that's important. Okay, so we're talking about probiotics, but what exactly are they? So this International Scientific Association for Probiotics and Prebiotics states that probiotics are live microorganisms which, when administered in adequate amounts, confer a health benefit on the host. So essentially, probiotics are a supplement that contains specific bacteria strains that's meant to provide a health benefit. So bacteria for health, kind of. The most common forms of probiotics are capsules. They also come in powders and even chewable forms. And then certain foods contain probiotics to kind of a lesser amount to get a really hearty kind of therapeutic dose of a probiotic. You generally would need to take a supplemental form. And now this is something that I can't say enough. All probiotics are not the same. They're not created equal. There's a huge variety in terms of probiotic products. So what really varies, the main things are the bacteria strains, what's actually in the probiotic, what bacteria is it, and then the dosage or the strength that varies from product to product. And also the quality. So how do you know you're actually getting what the container says? And how does the manufacturer and the seller, how do they ensure that quality controls are in place? With probiotics, often someone will ask me, should I take a probiotic, or they'll say, I've taken a probiotic and it didn't help me, or I'm taking this probiotic, is this okay? And the answer is really, it depends. I really need to look at the specific probiotic because all probiotics are so different. There's not a general answer because probiotics is just a really general term. So it doesn't tell me too much if I just know that someone's taking a probiotic. I need to know more about what's in it. So let's talk about this a little bit more. So the variation in bacteria strains for probiotics. So bacteria, again, your microbiome is bacteria. You have lots and lots of different strains of bacteria in your gut microbiome. So the bacteria in probiotics, it varies. The strains in probiotics should be listed on the container if you look at a container of probiotics, and they're identified by their Latin name, by the genus and the species. So for example, Lactobacillus, which is a common one that you'll see, Lactobacillus reuteri. The genus is Lactobacillus, and then the species is reuteri. Another common one is like E. coli. So the E is the genus, and the species is coli. Okay, so different strains of bacteria can support different health concerns. That's why it's important to know what's in your probiotic. And this is because they support different health concerns, it's best to talk with a doctor about, what strains are best for you. An example of this is Lactobacillus rhamnosus. And this is actually a little picture of it down here, these little orange yellow guys. Lactobacillus rhamnosus tends to be supportive for the female reproductive tract. So if someone is having a lot of having recurrent infections in that area, this specific strain, this Lactobacillus rhamnosus, it may be more helpful than just kind of a general probiotic blend or just grabbing any probiotic off the shelf, because we know that this one can be more supportive for that system of the body. And then the dosage or strength of the probiotic can also vary. So this is measured in CFUs, which are colony forming units. Bacteria, because these are all bacteria in the probiotics. So bacteria form colonies, and that's how they live, that's how they survive, that's what they do in your gut, they form colonies. So the way the measurement unit is colony forming units for probiotics. And the typical range is from 100 million to 100 billion CFUs, which is a huge range. And then there are definitely higher amounts, and you can also find some lower amounts, but this is kind of the typical range. And so those are really big numbers, but that's also a really big range. And then the quality. So the quality is important. Probiotics are alive. They're little tiny bugs that are alive, and they can die if they're not kept properly, if they're not prepared properly, if they're not transported properly, and if they're not stored properly. So that really means that you might not be getting the amount of the CFUs, the strength of the probiotic that you think you're getting, if the manufacturer doesn't have good quality controls in place. And not only the manufacturer, but also the distributor, the vendors involved, and then the seller, and then also what you're doing at home with the probiotic. If it needs to be refrigerated, is it in the fridge? Some don't, but just awareness around that. So the quality really matters, especially at the end where the probiotic is made. And then having that conscientiousness around all of those controls is important. So just to know, quality is important. And then I do want to just mention safety concerns. In general, probiotics are very safe. They're really safe, but they may not be appropriate for everyone. And adverse events, like things that we don't want to happen, they're rare, but they can occur, just like with anything. So most of the concern, if someone has concern, it tends to be related to the fact that probiotics are a bacteria, and introducing a bacteria to the body could cause or could worsen an illness. So it's unusual for someone to bring this up, but if they do bring up a safety concern, this is really the reason. And this is most relevant for those who have issues with their immune function or really severe illness. However, high quality probiotics could actually be beneficial for some of these people. So it really depends on the individual context, and you should always talk with your own doctor about that, especially if you have any kind of immune compromisation or illness types of issues. But I want to mention that just because sometimes that's brought up, how safe are probiotics? So again, probiotic is a really general term. So the best way to approach, what should I get in a probiotic is to really just talk about it with your doctor. And a good probiotic should support having a balanced microbiome. That's why we're talking about all of this, right? So once your microbiome is balanced, you should ideally be able to actually taper off that probiotic, because your microbiome, it's that ecosystem, it's ideally self-sustaining. You replenish it and give it the resources it needs, give it a little boost, and then it should be able to sustain itself. And again, there's all those different factors that can play into your microbiome health. So for some people, they do find that they feel better when they take a probiotic daily. I definitely have patients who know that their bowel movements are much better when they take a daily probiotic. But for a lot of people, it's not necessary. You restore and then you're kind of good and it self-sustains. Okay, so really common question, should I take a probiotic? The answer is it depends, right? We do individualized medicine for all the reasons we've talked about, and we'll go into more, but really being able to figure out what are we trying to do with the probiotic, what are the different strains going to support you with, is the best way to go. And then you can get probiotics through certain foods. So this is a lot lesser extent than supplements. Remember, those supplements were 100 million to 100 billion. So through food, it's much less, but it can still be supportive and it can still help to maintain some balance, especially if you're used to eating different types of foods, like for example, fermented foods. If you're eating a lot of sauerkraut, that could factor into how your gut microbiome is keeping itself balanced. It's used to having that. So some of the foods that have probiotics include things that are fermented. So things like kimchi, sauerkraut, kefir, yogurt, pickled vegetables, and kombucha. With yogurt, choose unsweetened if you can. There's a lot of different yogurts out there, but the ones that are flavored and sweetened, that extra sugar is really potentially feeding microbes that you don't necessarily want to be fed, and doing other things. So just a couple simple recipes here that you could do if you wanted to try making your own fermented foods at home. I won't go through this whole thing because this will be shared, or you could take a screenshot if you want to, but it's really simple to make your own pickled vegetables at home. So that could be like traditional pickles that we think of, but you can also pickle things like carrots or green beans. And the way you would do it is really simple. You have the veggies, you have your seasonings, your flavorings that you want to use. Garlic is a common one, garlic and dill. And then you put everything in a jar, you make this brine and you pour it over the veggies, and then you put it in the fridge basically for a few days, and they're ready to go. So pretty simple here. And you can also find all sorts of recipes for pickling vegetables online. And again, you can pickle anything. This picture shows some different pickled vegetables over here, but this can also be kind of a fun way to get different vegetables in different dishes. Like if you have like a big salad, or you could even put like pickled onions on like a burger. Not that you want to have a burger every day necessarily, but just you could use them in different dishes. So it could spice things up a little bit too. And you can use whatever flavors you like, obviously, with herbs and spices. Okay, and then another just simple recipe for sauerkraut. This is even simpler almost. You just need shredded cabbage. You add salt and you really kind of massage it in, and then you put that in a container and you essentially leave it out in your kitchen for a few days. You can taste a little bit each day. And then when you like the taste, usually 3 or 5 days, when you like the taste, put it in the fridge, and that's your sauerkraut. You can, of course, find recipes for this all over online as well. There's lots and lots of great recipes for fermented foods online. Okay, so that's the probiotics piece. And then prebiotics. So what are prebiotics? These feed the bacteria that's in your gut. So you can think of prebiotics like food for your microbiome. And technically, the microbiome, the bacteria, are going to ferment the prebiotics. And this helps your microbiome to really be healthy and flourish. It's like food that they're gobbling up. So prebiotics, they're not alive, they're not bacteria, but they are fibers like inulin and then polysaccharides. The most common are these fructo-oligosaccharides, galacto-oligosaccharides, and trans-galacto-oligosaccharides. Really long names, but they're polysaccharides. And so your gut bacteria like these, and they eat them up. And when your gut bacteria eat these, they produce something called short-chain fatty acids, which is abbreviated SCFA. And these short-chain fatty acids, these are actually really beneficial for your health in a lot of ways. So prebiotics, because of this production of short-chain fatty acids, in large part, have been shown to really benefit different aspects of health, including they can reduce irritable bowel, IBS syndrome symptoms. They can also support the health of your gut cells, again, those colon cells. They can improve calcium absorption. They can improve your immune response, your cognitive processes, and even your skin health. And prebiotics are available in certain foods and also in supplements. Foods can actually be a great source of prebiotics. And the foods that are really prebiotic rich, there's more than are listed here, but a lot of them are raw. So an unripe banana, raw garlic, raw onion, raw leeks, raw jicama, chicory, asparagus, sunchokes, oats, and some other whole grains. If anything on this list upsets your digestion, it's not, you don't want to use it, but there are other foods as well. You can find lists online of more prebiotic rich foods. And the reason that a lot of these are raw is because the fibers, the food content, it changes when you cook it. And not only that, but when you cook it, it changes. And then when it cools, when the food cools, it changes. And if you reheat it, it changes further, which is really just interesting because, each time it's heated and cooled, it's kind of changing the molecular structure a little bit. So the fiber content is going to be a little bit different, and it's not going to feed the the prebiotic fiber is not going to feed your microbiome, or you could think of it as feeding the probiotics even. It's not going to feed it as well if it's not in the raw form. Okay. And then there's this other term. This is kind of a newer term that I don't hear used a lot, but I want to mention it in case you hear it. It's called Synbiotics. And this is just a combination of probiotics and prebiotics in a supplement. Again, it's less common. And I tend to, if I do recommend prebiotics, I tend to tell people to get them through food because it's just a nice way to get your nutrients. If we can get things through the food that we eat, through our nutrition, that's, kind of better than taking a supplement. Just in general. Okay, so the bigger picture with all of this is having a healthy microbiome. So lots of people have different digestive issues like gas, bloating, constipation, soft stool on a regular basis. These are things that a lot of us just kind of learn to live with, and it just becomes the normal. But there are ways to improve that, definitely. And your body is always telling us something. So we really want to figure out what's causing the issue that's happening. And we want to address that, the cause. So we don't just want to relieve the symptom, but we really want to figure out what's causing it and address it at that level. So the problem is really at that level, at the causative level, not so much at the superficial symptom level. Although if we can alleviate the symptom, that's also nice, but we really want to get at that cause if we can. So how do we know if there's a gut microbiome imbalance that's causing different issues? Well, we want to look at your individual health context, and then we also want to do clinical evaluation and assessment and potentially testing. And then we want to make sure to rule out other conditions, underlying conditions. Autoimmune conditions are increasingly common and can be a factor with this kind of stuff too. So we would look at all of that to really determine, is there a gut microbiome imbalance and do we need to support it? And all of that said, it's not uncommon to have an imbalance in your microbiome because we live, in our modern world. There's a lot of different exposures that we have, a lot of different stresses and burdens on the body every day, maybe a little bit differently during the pandemic for some of us, but whether we recognize this stuff or not, we do have our health impacted every day, and our body is amazing, and it deals with it and it takes care of us. That's what the body is meant to do. So so just recognizing that as well, I think, is important when we're talking about all of these things that can kind of be an issue. The body is really amazing and takes care of us with everything. So let's look at some research that illustrates how the microbiome can really influence different systems in the body. And here's this picture again that I like. And just to remember, with all these different systems, everything can affect everything in different ways. And often it's in indirect ways that we may not think about, but that are definitely at play. So one of these issues that is, I don't want to say common, but often seen maybe, is irritable bowel syndrome. So essentially changes in your bowel movements, constipation and or diarrhea. It can vary. A systematic review and meta-analysis that was published in the World Journal of Gastroenterology stated probiotics reduce pain and symptom severity scores in IBS patients. The results demonstrate the beneficial effects of probiotics in IBS patients in comparison with placebo. So just kind of a general statement showing that probiotics supporting that gut microbiome can be helpful for alleviating some of these IBS, irritable bowel syndrome symptoms. Okay, and I just want to mention, I can't see the far right side of my screen. So if I misquote something here, that's why. I will try not to, but just in case. And then another condition that we see is eczema, which is also called atopic dermatitis. And here in this research, it's abbreviated AD for atopic dermatitis. So this is eczema. So a meta-analysis that was published in the American Journal of Clinical Dermatology stated probiotic supplementation during both the prenatal and the postnatal period reduced the incidence of atopic dermatitis or eczema in infants and children. Our findings suggest that starting probiotic treatment during gestation and continuing through the first 6 months of an infant's life may be of benefit in the prevention of atopic dermatitis or eczema. And so a lot of immune development happens in those early stages of life. And so by supporting the immune function, actually with supporting the microbiome through probiotics, it can be benefiting something like eczema. And then asthma, which is actually another atopic condition, another kind of allergy-related condition. A meta-analysis that was published in the journal Allergy and Asthma Proceedings stated, this study showed a significant benefit that supplementation with probiotics in pre- and postnatal periods was likely to play an essential strategic role in prevention of asthma. However, these effects were based on the type of probiotics used, which also need more large sample and high quality RCTs, randomized controlled trials, to confirm the reliability of this study. So this kind of underscores what we mentioned earlier, that all probiotics are really different. And so when we see these different like meta-analyses or systematic reviews, they're looking at lots of different studies and kind of in a sense, like making the data as concise as they can to draw conclusions from everything. That can be really hard with probiotic studies because every probiotic is different. You know, they're so different, what's in them, you know, the strengths of what's in them. So this can be really hard. So the researchers here are just recognizing this. And then immune function. So a meta-analysis that was published in the journal Nutrition Research stated, short-term probiotic supplementation enhances cellular immune function in healthy elderly adults. The time frame for this study was 3 to 12 weeks because it's a meta-analysis, so it's taking different studies and looking at them. So the time frame among all those different studies was 3 to 12 weeks. And then they evaluated healthy immune function by looking at different types of your immune cells, specifically here, what are called PMNs or neutrophils, and also NK or natural killer cells, just a part of the immune system there. So looking at those, they were able to draw these conclusions that probiotics can enhance healthy immune function. And then C. difficile, so this is Clostridium difficile infections. So these can become very serious for people. And Clostridium difficile, this is actually one of those bacteria strains that lives in the microbiome. It's in everybody's microbiome right now. It's not a problem unless it overgrows and becomes really kind of a bad pathogenic thing then. At a normal level, it's just kind of, it's very, very low amount and everything else keeps it in check and it's all good. It's when it becomes overgrown that it really becomes a problem. So again, that whole ecosystem of the microbiome. So with C. difficile or Clostridium difficile infections, this article was published in the Cochrane database, and they stated, based on this systematic review and meta-analysis of randomized controlled trials, including 8,672 patients, moderate certainty evidence suggests that probiotics are effective for preventing Clostridium difficile associated diarrhea. So this just speaks towards supporting that balance of the microbiome. And they looked at a lot of, they had a good sample size here with all the people in these different studies that they looked at. And with C. difficile, I want to just mention this as well, because if you've heard of fecal transplants, this has become a little bit more researched now. So a meta-analysis that was published in the PLOS 1 reviewed the efficacy of fecal microbiota transplantation, or FMT. And the authors stated, and I'm probably not going to get the far right part of this quote, so I'm sorry in advance, but overall, the use of fresh stool, and I censored a little bit of language there so that nobody was too grossed out. So overall, the use of fresh stool for bacterial transplantation was shown, I'm gonna guess, was shown to have the best efficiency for recurrent C. difficile infection compared to antibiotic therapy or placebo. The fecal transmission method by enema was not ideal, but capsule or frozen feces or stool transported by colonoscopy could be an alternative treatment compared to fresh fecal microbiota transplant. So just they're making the process a little bit easier for people. For patients with severe recurrent C. difficile infection, multiple fecal transplants can effectively improve their diarrhea remission rate. The focus of future research should be on how to standardize the production of capsules or frozen feces to better guide the clinical management of recurrent C. difficile infection patients by fecal microbiota transplantation. So all of that to say that the fecal microbiota transplantation, these fecal transplants, they are really showing that they can help. And the thing that is happening there is that when you're doing a fecal transplant, you're giving the ill person some different bacteria, some different microbes in that fecal microbiota sample. You're giving them different microbes, and then those populate in their gut. And as those grow, as that new stuff grows, it can help crowd out the C. difficile. It can help to kind of balance things out. And this has been shown to really, really be pretty effective when there's not a lot that can be so effective for C. difficile. So this is really promising that they're finding kind of more efficient ways for people to have these fecal transplants. Okay, and then shifting gears a little bit to depression. So depression can also be impacted by the microbiome, or rather the mental emotional state that we think of can be impacted by the microbiome. So a meta-analysis that was published in the journal Nutrients stated, we found that probiotics were associated with a significant reduction in depression, underscoring the need for additional research on this potential preventive strategy for depression. So seeing that probiotics, which again, benefiting that microbiome, can help to reduce the symptoms of depression. And then interestingly, this meta-analysis, the same one, also stated that probiotics had an effect on the population under 60, but it had no effect on the people aged over 60. And other research has actually shown that probiotics may be more beneficial for older individuals. So this is interesting. So it may be that the older the microbiome, the longer that beautiful ecosystem has been around, the more support it may actually need. So it may be that in the study looking at depression and probiotics, the population over 65 may have just needed a higher potency probiotic, or potentially, different strains, quality considerations can come into play there. But just to point that out. And this again underscores the importance of having an individualized approach and not just taking kind of a general approach, not really one size fits all. So again, an individualized approach is really best, and that includes your microbiome. And it's really best when you can talk with your doctor about what's going to benefit you the most, and looking at everything as a whole picture for you as a whole person. So some key terms here, just to kind of recap things, some key terms, your microbiome. So that's the ecosystem of all these tiny little organisms that live in and on your body. And when we talk about microbiome, we're usually talking about the gut microbiome. And then probiotics, which are the bacteria that are intended to provide some health benefits and to help balance that microbiome. And then prebiotics, which are the food for the probiotics. And then some takeaways here. So one that I, again, want to emphasize is that all probiotics are not created equal. There is a huge, huge variety in them. So remember, the big differences, the difference categories, big ones are strains, strength, and quality. The different strains of bacteria, different strains have different health benefits and relate to different things going on in the body. And then the strength, those CFUs or colony forming units, there's a huge variation there. And then the quality, if you're not getting a good quality probiotic, whatever it is, you're probably not getting, well, you're not getting what's on the container, what's listed there. And it could be questionable if you're getting any benefit. So the quality is really important. It's kind of a foundation for making sure you're getting benefit from a probiotic if you take one. And then other key takeaways are that your microbiome is really impacted by so many different factors every day, including, what goes in your body, food and drink, but also stress. Stress can definitely impact your microbiome. So taking care of yourself as a whole person is really important. And also recognizing that your body is already taking care of you. Your body's amazing, so it is taking care of you. And the more care you take, the better your microbiome will be. And then probiotics can really help to restore balance to your microbiome if you need them. And prebiotics can also be supportive because they're giving you the probiotics and the microbiome, that kind of fuel to eat. One note here is if you start having more gas, passing more gas that's not smelly, when you're taking a probiotic or when you're having a prebiotic, that could mean that you have enough and you don't need more of the probiotic or the prebiotic, especially if you started to eat a lot of raw bananas, for example, or like raw onions, and then you start having a lot of gas that's not smelly. That could just be that you're putting a lot of fiber in there and those bacteria are really enjoying it, but it's a little bit too much. So just to mention that, having extra gas is not the goal here. And then antibiotics, we know they destroy some of the microbiome, so a probiotic can help to replete that, to replenish what has been destroyed, both during and after. Again, it doesn't affect the efficacy of the antibiotic, but you do want to take it away from the antibiotic so that the antibiotic doesn't kill it. And it's a good idea to discuss that with your doctor if you are taking an antibiotic. And then other substances can also impact your microbiome. And just talking about your own needs with your doctor is going to benefit you the most, really, with all this. So just one more reminder, you're an individual. So all of this information is for education only, not health advice. Always check with your doctor. Okay, I'd be happy to take any questions if anyone has questions. And I have my website here too, if anyone wants any more info or resources. So thank you for listening. Are there any questions right now?
I just had a quick one. I think earlier you had said that some supplements can also affect your microbiome. Like, what are some examples of supplements that might do that?
Yeah, and so I'm going to give you a few parts to the answer. That's a good question. So it's going to depend on the individual microbiome as to what's happening, and then also, the specific supplement, but just in general. And this will probably make sense so if you're taking a supplement that is meant to potentially support immune function or to maybe cleanse things or detox, or even, in different supplements you take, there could be different herbs that could be kind of antimicrobial herbs. So things like that could definitely impact the microbiome because they could potentially kind of kill off some of the microbes, the bacteria there. And then also, depending on what a supplement is, if you're taking a lot of a certain nutraceutical, like if you're taking like a lot of a certain protein powder or amino acids, or really anything that throws the balance off of some of those bacteria, that some of them gobble it up and enjoy it and others don't, that could impact things too. But it also it depends kind of for some of it depends on the individual microbiome that you have, and sometimes cleaning a little bit out can be helpful. We do that sometimes for therapeutic reasons, but different supplements can affect them. But in general, the supplements that are going to kind of give you immune support and potentially have antimicrobial properties, those would be the ones that would probably affect the microbiome more for most people. Does that make sense?
Yes.
Okay.
Thank you. Someone else asked, how do acid reducing medications like Pepcid affect your microbiome?
Yeah, that's a good question. So if you think about it, when you take something like that for reducing stomach acid, you're taking that and it's going to kind of address your stomach area, which is very far in a sense from your large intestine. So depending on, and we didn't really talk about this piece of things, but there are other potential issues that can come up with bacteria in the digestive tract, like something called H. pylori, which can become an issue for some people. So and it depends. I don't want to. I can't really speak to individual health, but potentially taking in something that's going to reduce stomach acid could impact the flora there in a sense enough to allow some of this H. pylori to overgrow, and that could cause other issues. And then there's also something called small intestinal bacterial overgrowth that you've probably heard of. It's abbreviated SIBO. So that's more in the small intestine, which is, much closer to the stomach. And that's different than the general microbiome that we're talking about in the large intestine. But the medication effects, regardless, they could impact still the microbiome in the large intestine, even though it's further away. But with an acid blocker, I would want to kind of ask you some more individual questions to know really how is it impacting you. But the less you have to take, the better, because that can certainly impact. I hope that's helpful. If you have additional questions on that, let me know. Yeah, good question.
Okay. Does anyone else have any questions?
No, but thank you very much. That was very informative.
Oh, good. You're welcome. I'm glad you enjoyed.
Yes. And, so if nobody has any questions, we can just end the program. But I want to thank you, Dr. Cannon, for taking the time out for quite a few months. You've done wellness talks, and I found them really informative and helpful. And hopefully we can plan more in the future. So I really thank you for taking the time to do this.
You're welcome. It was my pleasure. And yeah, I love doing these talks. So thank you for providing the space for me to do them and share.
Maybe one of these days we can do it in person too. Keep our fingers crossed.
That'd be great.
Yep.
That'd be great.
All right. Well, thank you again, everyone, for coming.
Yeah, stay well.